Pathophysiology is the point where many nursing students start to feel lost. The terms become complex, the mechanisms feel abstract, and it often seems disconnected from real patient care. Many students ask why they even need this level of detail when their job is to provide care, not diagnose disease. Welcome to the Learning Studio, where we don't just teach theory, we show how knowledge turns into real-world understanding. The truth is, pathophysiology is not about memorizing diseases. It exists to explain why a patient looks the way they do, why symptoms appear, and why certain nursing actions matter. Without this understanding, nursing becomes task-based. With it, nursing becomes intentional and safe. Think of pathophysiology like understanding why a room gets cold when a window is broken. You don't need to be a physicist, but if you understand that cold air is entering and heat is escaping, you know what to fix. The body works the same way. When a system fails, signs and symptoms appear for a reason, not randomly. At the bedside, pathophysiology explains what nurses observe every day. Shortness of breath is not just discomfort, it reflects impaired oxygen exchange. Swelling is not just fluid buildup, it reflects changes in pressure and circulation. Fever is not just heat, it is the body responding to infection or inflammation. When nurses understand these connections, assessments become meaningful instead of routine. Students often try to memorize symptoms as separate facts. Experienced nurses see patterns. They recognize how one system affects another. A failing heart impacts lungs. Poor kidney function affects fluid balance and blood pressure. Pathophysiology connects these dots so nurses can anticipate problems instead of reacting late. In real healthcare settings, this understanding guides nursing priorities. It helps nurses predict complications, recognize early deterioration, and understand why certain interventions work. It also explains why some actions can be harmful if done at the wrong time. Nursing judgment grows stronger when actions are tied to cause and effect. The nclex reflects this reality. Questions often describe patient signs rather than naming a disease. The exam expects you to recognize what is going wrong inside the body and choose the safest response. You are not expected to diagnose. You are expected to understand what the body is struggling with. In practice, nurses use pathophysiology as a thinking tool. They ask what system is affected, how that affects the rest of the body, and what could worsen the situation. This mental process supports better monitoring, clearer communication with the healthcare team, and safer patient care. Now that you understand how pathophysiology helps nurses interpret signs and symptoms instead of memorizing conditions, the next step is learning how this knowledge supports infection control and patient safety. That connection becomes critical in every healthcare setting, and that's where we'll go next here at the Learning Studio.